this video is to teach home care of Jackson Pratt drains. The points that I will cover in this video are what the drain is, why it is needed, when it will be removed, how to empty the drain, resuction the drain, and measure the output, how to strip the drain, how to change the dressing around the drain, and when to call your doctor with signs and symptoms. I will be using Dan as my patient, and he will be helping us demonstrate how all this works. Hi, Dan.
Hi, how are you today?
Good, how are you?
Fine.
A drain, this is a type of drain that is placed in an incision during surgery to help remove excess fluid and blood from around your incision site and from under your skin. A JP drain is made up of a hollow tube that begins inside your incision and exits the body attached to an egg-shaped bulb that collects it. The drain uses suction to remove this fluid and excess blood, and it will not work if your drain is not properly suctioned. JP drains are temporary following surgery because they help keep fluid from collecting in your wound. As your wound heals, the color of drainage in your bulb should go from being bloody to clear, and the amount should decrease. Your drain will be removed at your office visit once your drainage output has stopped or slowed down. We're going to go over how we empty a drain. Okay? All right, so you're going to hold on to your drain there, and you're going to pull the top off. Now, using your measuring cup that we provide you with, you're going to carefully turn your bulb upside down and gently squeeze your contents in there. Okay, good. We're going to set that aside for a moment. Now we're going to resuction your bulb. So you should squeeze firmly in the middle and replace your plunger while you're still squeezing your bulb. Now it's important to measure the output and note the color of your drainage. You should keep a record of this, which you will empty your drain 3 times or every 8 hours. And you're going to keep track of this so you can let your doctor know how your fluid is decreasing. Okay? So we have about 60 in there and it's clear. Good. Every time you empty your drain, you should also strip your drain to prevent clots from forming and clogging. So to strip it, you're going to hold firmly up by the incision so we don't pull it out.
Okay.
Okay? And then with your other hand, you're going to take your thumb and your forefinger and you're going to create pressure and squeeze down. And good, just like that, and drag it down. Don't release your pressure until you get to the bottom of the bulb. And you want to repeat that a couple times. And again, this is to prevent clots from clogging your drain. Okay? Now that we've stripped our drain, we're going to empty our output, which you should do into a toilet, and then flush it. And then you should rinse your cup out. If you were to have more than one drain, you would have a separate cup for each one, and you would keep separate records for each one. Okay? So, every 8 hours, we're going to empty and strip. Got it? Okay. Next, we're going to change the dressing around your drain, and we're going to take a peek at the surrounding skin as well. We're going to be looking for any increased redness, swelling, pain around your drain, if your drainage is pus-like,
Okay.
or foul-smelling, okay? Your drain looks good.
Okay.
So now, we're going to create a drain sponge using a gauze pad. And to create one, you're just going to take your gauze and you're going to cut in the center, just up about halfway. And then we will place it around. Okay, and then we are going to tape each side. Be careful with your tape so there's no crinkles in it. Crinkles will cause your skin to break down.
Okay.
Okay. Another thing that's important to do is you want a safety pin using this loop. You put a safety pin through here and you want to pin this to your clothes so it doesn't pull out.
Okay.
And it'll be more comfortable for you so it's not pulling on it.
Okay.
Okay. So now we're going to talk about signs and symptoms that mean you should call your doctor. We did our inspection of your site, and if you would have noticed any redness, pain, swelling, or drainage around your site, you should promptly call your doctor. You should also call for pus-like or foul-smelling drainage in or around your drain, bleeding, a temperature greater than 100 degrees Fahrenheit for more than 4 hours, a bulb that will not stay compressed or fills with air, or if your drain comes out. Okay? Do you have any questions?
How many times do I empty the drain?
You empty it 3 times a day or every 8 hours.
Okay, thank you.
And make sure you strip it every time
All right.
to prevent clots.
Thank you very much.
All right. Thank you, Dan.
Have a nice day.
In conclusion, you should now be able to identify what a JP drain is, why it's needed, when it will be removed, how to empty the bulb, resuction the bulb, and measure your output, how to strip your drain, how to change the dressing around the drain, and signs and symptoms that you should call your doctor with.